I'm Norley, and today I'm joined by Avril Benoît, the Executive Director of Doctors Without Borders in the United States. As an international medical humanitarian organization, Doctors Without Borders has long worked to provide medical aid where it's needed most. And with the COVID-19 crisis raging, that has included work right here in the US. Avril joins us today to talk about the organization's COVID response and how people can help. So let's get started. Doctors Without Borders has been providing life-saving medical care in response to public health crises for almost 50 years. What makes this public health crisis different from others that your organization has responded to?
The number one thing is that it's happening everywhere at once. Normally we would have an outbreak, an epidemic, even something very serious in one country, one region within a country. The Ebola outbreak in West Africa obviously spread out over several countries. And with things like measles or malaria, we might be dealing with it in many countries. And maybe you have the rainy season and you'll have a peak that all happens at the same time. We see this with malnutrition, when you've got a crisis of food security where people just can't have access to food, especially if there's drought. With climate change, we're seeing increasing numbers of vulnerabilities around these issues. But it'll affect one region. It's going to pop up in certain pockets of the world. And obviously with this pandemic, with COVID-19, not only was it happening, initially we saw the big surge in Europe. We saw then a big surge in New York City, where our headquarters in the US are based. And at the same time, we had to prepare our global operations to make sure that our medical staff could protect themselves and protect the people that are coming into our medical facilities from the risk that there would be local transmission. So the fact that it was just all happening at once became extremely overwhelming, I must admit. And at the same time, we've never felt more valuable. We never doubted that we had a big role to play because we have so much experience responding to epidemics. We know what to expect.
So how did you then triage with all that need? I mean, how do you determine where you go first?
It's a great question, and it was quite a puzzle for us because most of our work, a good 65%, is focused on operations in sub-Saharan Africa. And then maybe you have another 20% in the Middle East, conflict zones, places that are in desperate need, low-income countries where there's a great deal of gap between the needs and what the state has the capacity to offer when it comes to healthcare. In this case, the fact that it was happening in Europe and then in New York City, we had a real question on our minds because, of course, a country like the US is wealthy. We have the means, we have a modern healthcare system, but what we didn't have here is equitable access. And so we started to reflect, all right, well, given the rates of transmission, given the specific vulnerabilities that do exist in the United States, can we be of service? So in fact, for the first time in the history of the organization, we actually started having some projects in the United States in order to give us that voice to be able to support local community organizations or local health officials to be able to boost their capacity. It was a great way for us to show that we were with everyone here in the US, that even though we're an international organization, we were all feeling it profoundly in our own communities across the country. But we knew it was unsustainable because, to be perfectly honest, Pam, it's a lot more expensive to provide healthcare here in the US. And we knew that in places like Yemen, South Sudan, Democratic Republic of Congo, in many locations, we are providing that life-saving medical support to communities who are at the most vulnerable stage of their lives, communities that are moving. Right now we've got a whole scale up happening in Sudan with people coming across from Ethiopia. So we've got medical pop-up clinics everywhere. That's where over the long term, we have to focus to make sure that those kind of settings, which are the classic emergency humanitarian settings, also have this additional lens of COVID-19, what do you do? How do you protect everyone coming through? So that's where we've really decided to focus. And for the coming months, the next big issue will be making sure that people have access to the vaccines and other therapeutics, other testing. If we ever get to this magic moment of having these resources available to all, who are in need, we need to also make sure, and we're one of many organizations doing this, that we're advocating for low-income countries that are already in crisis, or at least parts of them are in crisis, that if they have a huge surge of community transmission, that they also have access to things like the vaccine or the new therapeutics that are coming around.
You support 70 countries around the world, obviously, no more recently the US. How are you thinking about the recovery? I was happy to hear you saying you're already starting to think about vaccination process and systemization of how that's going to work. How are you thinking about preparing for that?
For us, we have a lot of experience in mass vaccination campaigns. And the typical thing you do, and I've been involved in many of these in the past, is that you bring a whole bunch of people together and you're under a tent, and the tent moves from place to place, community to community, and we really can become one of the great partners for local health officials, because we have the cold chain expertise, we know how to, we have the logistical might to be able to support them. For us, there's a tremendous amount of learning that we've acquired that we really want to share, and that we work very much in partnership. But the other thing is, we have a lot to learn as well, even in the West, about how to limit infection prevention, control, limit the spread of the virus through different techniques, which are showing that they really work. So in many of the places in sub-Saharan Africa, for example, where they've had big outbreaks, and where there is a high degree of trust in local authorities, local community leaders, scientists, health people, who are telling them very straight, we have to all lock down, or we have to all wear masks, or we have to all wash our hands. Over the years, community health worker models and health promotion, which is one of the simple ways that we do our medical work. You might have a hospital, but then you've got hundreds of health promoters who are from those communities. They're often local women who know everybody in the block, in their village, and they're responsible for those ones. And if they see somebody with a bit of a fever, if they see a child who looks at risk, if they see an elderly person who might be experiencing symptoms akin to whatever the outbreak is, they know what to do. They know how to guide them toward the health facility and advocate for them. And that model has proven itself in this particular pandemic. So there's a tremendous amount of very exciting work that's being done at the local level that, I think we're going to look back on all of this and say, wow, in West Africa, for example, they knew what they were doing. They've dealt with this before. They knew how to organize, because they had such an extraordinarily dramatic and tragic experience of Ebola some years ago. So we certainly have a lot of global sharing in the scientific community that we believe is very important to have open access, freely available. We do our part to publish our research, publish what we're finding on the ground, and to make sure that others have access to that in case they're working without the benefit of our presence on the ground.
Avril, thank you so much for taking time with us this afternoon to share the important work that Doctors Without Borders is doing around the world. We're very grateful for your time, and stay safe. Thank you.
Thank you so much for that.